Hot flashes, weight gain, irritability. Are you going crazy, or is there a hormone imbalance going on here? Maybe menopause. Here to talk about this today is Kyle McAvoy, a nurse practitioner at Pearl Women's Center. Thanks for being here.
Thank you for having me.
Let's talk first about the symptoms of menopause. And what are they, first of all?
Well, I hear all kinds of things in my practice. Women can come in feeling tired, irritable, moody, at the end of their rope. They can't stand their family. They feel like they can't get sleep. They have hot flashes, night sweats. They have that menopause, that little belly fat. They just don't feel like themselves. The common thing I hear is, I'm a really nice person. I didn't used to be like this. I don't know what's wrong with me.
Isn't that interesting? Because that's what makes it difficult, I think, for a person who's experiencing that. They don't think it's medically connected. They just think they're crabby, right?
Right, and oftentimes they've gone to another provider before me and talked about these things, and they've had a test done, and they're told everything's normal, and there's nothing worse than being told everything's normal when you're not feeling that way.
So what's happening to us? What's happening to our hormones as we get older?
That's a great question. So as we get older, our hormones when we're young are very finely tuned. In a way, we have estrogen, progesterone, testosterone. Those are the three main players when we think about hormones. They're very finely tuned in such a way that our periods happen on a predictable lunar calendar in a way that we can get pregnant. The whole idea is to have conception each month. As we age, that begins to change. The first hormones we see dropping are progesterone and testosterone. That leads to the irritability, the carbohydrate intolerance, the low libido, the weight gain around the belly. So things begin to shift as early as in your 30s.
I was going to ask you about that, because I think women, when they start feeling this kind of thing, and they're not in their late 40s, 50s, 60s, right, they're thinking, no way, is this menopause? So there's hormone imbalance and menopause. They're kind of two different things, yes?
Absolutely. The definition of menopause is a very distinct one. It's 12 months in a row, after 12 minutes in a row of no periods. That's menopause, after that period happens. But perimenopause begins in the early 30s, lasts into the late 30s, early 40s, and into your 50s, depending on when you're going to have menopause. So we say anywhere from 10 to 15 years before actual menopause.
That long?
Can be, for some women. Other women, they're lucky. They don't have all these symptoms, but I would say predominantly women have at least a few.
Okay, so what usually brings people into you? What is that symptom that says, I've got to get help?
Many times it's hot flashes or night sweats. A lot of times it's irritability and fatigue. Fatigue is a huge symptom. I mean, how many people do you know that say, I'm just so tired. I can't sleep well. I don't have the same energy I used to have. Sometimes it comes from an annual exam, just coming in saying, I'm here for my pap smear, but oh, by the way, I have X, Y, and Z. So I'll often say to them, well, let's think about looking at your hormones and see if perhaps that's causing your symptoms.
And do other people bring their loved ones in when sometimes that irritability might be showing a little bit further?
I have a lot of husbands who bring their wives, and a lot of boyfriends who bring their girlfriends, and saying, this isn't the same person I married. Or the woman will say to me, they'll say, I used to be so different. What happened to you? And they're thinking, what is wrong with me? And I think that's a very lonely place to be.
Well, I would imagine when you're listing all the things that you were earlier, there are a lot of people out there going, what you just said, yes, I can relate to that. I never even thought that that might have something to do with a hormonal imbalance.
And I think there's a lot of very lonely women out there that are just suffering alone, suffering by themselves. They're afraid to admit that, maybe I'm not doing as well. So they come in there, every morning they get up and they look great, but they don't feel great. They're just hanging on by a thread.
What about the women who go, oh, so I'm having some night sweats. It seems kind of silly to go to a doctor about that.
I think that's true. I think there's a lot of disservice. But the good news is that I think more and more the women's magazines, the Oprah, the shows that are out there, like the show like this, it teaches women that it's okay to say, I could feel better, especially if you felt better when you were younger. It's very strange to not feel good anymore. You wake up and you think, I'm too young for this.
And certainly that's what people want. They want to feel better. But we have to put it out there. There's been a lot of press, both good and bad, about hormone replacement therapy, which has been the way people have gone to alleviate these symptoms. How do you address that, and how does bioidentical hormone therapy, which you deal with, differ from, say, the traditional kind?
We've done women a great disservice. We have so many sound bites in the news media. We have studies that say hormones are okay 1 week, and the next week the same news journal has the studies are not okay. The problem began back in the, when hormones first came out, we gave women synthetic hormones to alleviate their symptoms in the form of Premarin. Premarin's made from horse mare urine, pregnant mare urine. If you know it, now you put the name together with how it's made. We put women on estrogen alone, and they felt better. But then we found out that women began to get uterine cancer because they had unopposed estrogen in their body. So that was the first mistake we made. Then we came up with a synthetic form of progestin to protect the lining of the uterus. So those women no longer got cancer, but they began to have side effects like weight gain, irritability, acne. So then, studies were done. We wanted to keep showing that hormones were safe. So many studies showed that even synthetics were safe. But then the big granddaddy of all studies came out in 2002. It was called the Women's Health Initiative. And that study showed that women on synthetic combination of the Premarin and the progestin, which is the synthetic form of progesterone, had a slightly increased risk of breast cancer. Some women had increased risk of heart disease. So everybody was said, go off hormones. But most of us in the field knew that that was just one study, and it wasn't a very good study. It wasn't very well done. So many studies have been done since then, and bioidentical hormones are different. They mimic our own body's hormones, and progesterone is what our body makes. We don't make progestin. Progestin is a synthetic form of hormone. It doesn't look the same. It doesn't act the same in our body. So progesterone, there's actually some very good studies coming out in Europe that are showing that progesterone has no effect or a negative effect on breast cancer. It may, in fact, slow the growth of some breast cancers. And estrogen, when given through the skin, transdermally, has no increased risk of strokes or heart attacks. So there's lots of ways around some of those studies that have been done.
So where do you get the bioidentical hormones? Where do they come from?
All hormones come from either a plant base or an animal base.
Okay.
Synthetics differ in that they don't look exactly like our hormones. The bioidenticals look exact. The molecules, if you looked at them, as a pharmacist looks at them, they look exactly the same molecularly. So they mimic, it's like a key going into a lock that fits perfectly, as opposed to you have a key that kind of fits and you jam it in there, it does some damage on the way in.
So tell me some of the clients that you've had or patients that you've had, once they've done this, tell me what they say to you, some of the things that they come back and say to you.
Well, so when I see patients, they have all these symptoms the first time and they're just a mess. And I always write all those symptoms down because nobody remembers how bad. Remember how you've had the flu and you feel awful, but the next week you feel great, so you don't really remember that. So I write all those symptoms down. No libido, insomnia, night sweats, the whole thing. And I do the testing. So I do saliva testing. We can get into that soon. I do some other blood tests. I bring them back in. I get them on a therapy. And I usually bring them back about 8 weeks later. 8 weeks later, I say, how are you feeling? And what I love to hear is, I have my life back.
Oh.
I feel so good. Yesterday, a woman told me that she called me her angel. It was so cute. And it's just one of those things. I just feel so blessed to have chosen this line of work and to really help people feel better.
I love how we do kind of shut it out, though, don't we? We just try to block out that feeling that we felt before. What a great idea to say, here's what you said when you came to see me,
right,
and here's how it's different today.
Well, it's hard to remember how terrible you felt. Who wants to remember that? You know, you have a new day here, you wake up and I say, I have my life back, my husband likes me again, I have energy to spare, I'm exercising again. That's another thing. One of the great studies that was done, a very small study in Texas, was done by a physician on women on transdermal estrogen and progesterone versus placebo. And she found the women who were on the hormones, the bioidentical hormones, actually had more energy to begin to do the work that we always tell people, lose weight, choose better foods, do this, but they're too tired. You get them on a hormone therapy, they have energy, now they can do it.
Well, let's talk about that because it really is a whole package. It's a lifestyle approach. It's not just the bioidentical hormones. Elaborate on that, will you?
So in our lives, we get exposed every day to all kinds of hormone disruptors. I was just listening last night to a show on bisphosphonaol A. It's an estrogen mimic. When you have those plastic bottles and you eat those, use them to drink your bottled water that you think is so great, it's causing a hormone change in your body. Some of the aluminum cans have hormone disruptors. So inorganic food, all the things we're exposed to, dry cleaning solvents in our day, stress, the way we live our lives. We're so busy in the United States. We go from, and I'm guilty too, but we go from thing to thing. So when the lifestyle is out of whack, of course our hormones are going to be even more out of whack. So when I talk to women, first I find out what's going on with them. And I don't want to overload them with too much stuff because nobody can make all the changes at once. So first we start with the hormone balance, and then we look at things like vitamin D. Has your vitamin D level low? Is your B12 low? Is your iron low? And then I look at their lifestyle. Tell me about your diet. Tell me what, do you eat Twinkies for breakfast?
How many hours of sleep do you sleep?
Yeah, how many do you sleep? And do you ever get some rest? Do you ever get some time for yourself? Do you exercise? These are very critical factors for hormone.
Is there a common, I don't know if I want to say void, but in other words, are few women having vitamin D, or are they having poor diet or lack of exercise? Is there one thing that you can just say, oh, almost every woman is this?
I would say Probably the majority are deficient in D. Many are low in ferritin. Now, ferritin is, when we talk about anemia, we always measure the CBC, complete blood count, and we look at the actual blood cells. But ferritin is an actual iron store, and sometimes your CBC can be normal and your ferritin can be low, and you can have symptoms of, peeling nails, fatigue. And so I look at those. And then thyroid, we talk about thyroid, we'll talk about adrenals. So there's many things I look at. There's a whole balancing operation we have to do here, basically.
Is it often a thyroid case, or does that come up a lot?
It does come up a lot more than you'd think. And I practice more of a functional medicine approach. What I explain to my patients is a straight medical approach is you have a normal set of labs and you have an abnormal set of labs, and there's really no intersect. When you walk along the gray line somewhere in the middle, you can see how disease has a continuum. So I function more and I approach more in the continuum of the labs and how a person's acting. If a person has every symptom of thyroid and their labs are close, that's called a functional hypothyroidism, and I'm happy to treat them in that way.
Now, conversely, if somebody comes in and their symptoms aren't that extreme, do you find that sometimes just the holistic approach is enough?
Absolutely. Just changing their diet, changing their stress level, giving them some vitamin therapy. Absolutely. Just sometimes knowing what it could be and getting it out of your head, thinking it's all in your head, that can be enough for a woman to make the changes. She just feels relieved. Going home I try to give women the lab slips that, I draw the labs, I do the salivary testing, and I give them proof of why they're feeling the way they do. And that's huge. It's objective data to bring home and say, I'm not crazy.
See? Kyle told me I'm not crazy.
Exactly, and that gives them a lot of cred. People want that, affirmation that I'm okay. There's something really wrong that I can fix.
Is there something that you look forward to in the future with bioidentical hormones, or studies that you know of, or something that you're thinking, wow, it's going to get even better because? Every day.
There was an article that came out last week in one of the major publications, the New York Times, talking about this. Didn't get it quite right. Nobody gets it quite right just yet in the news media, but it's just about, hormones. There was a study came out recently that said estrogen alone is okay. It doesn't increase the risk of breast cancer, but we know estrogen alone is not okay because of the risk of uterine cancer. So we're moving forward slowly, and European studies are coming out all the time.
Boy, if we could learn anything today, it's that you really just can't broad brush this, can you?
No, you can't. And you can't listen to sound bites. Sound bites sells news, but really digging in deep is how you want to do it. And I just wanted to, an aside, I was trying to think of a simplistic way to sum all this up for patients. I went to see a great speaker the other night, Michael Pollan, who's written The Botany of Desire. He's written In Defense of Food, and he's always trying to explain, how should we eat? Is it cholesterol in, is cholesterol out? Is it antioxidants? And people can't keep it straight. And he said, eat food, not too much, mostly plants. And so eat food, meaning whole food. And I guess I want to say that to women is just strive for balance, in your life. Don't do too much every day. Learn to say no. Choose organic food over inorganic food. Take time for yourself. Take time for your family. Self-actualize. Do all those things. And then the hormone balance will come as well.
And sometimes if we need that extra push, you're the person we come to see.
Absolutely.
Kyle McAvoy with Pearl Women's Center. We've been talking about hormone imbalance, menopause, and there's hope for women out there, isn't there?
There really is. Thank you.
Thank you.